St Lucia becomes the first in the Caribbean to have 100% of all COVID-19 patients recover. Latin America's hardest hit country, Brazil, is considering ending social distancing measures in height of the COVID-19 pandemic. And China pledges $30 million more to the WHO's coronavirus fight after the U.S. halted funding. Hello and welcome to Telesur English. I am Estefania Bravo in Quito, Ecuador. This is from the south. As of Wednesday, 100% of the people who presented with COVID-19 in St. Lucia have fully recovered. The Caribbean island reported its first imported case on March 13th. By April 10th, the country had 15 confirmed cases. Taking to Twitter, Prime Minister Alain Chastanet said all patients had received a negative result with no additional positives recorded. Jamaica has recorded 19 new COVID-19 cases in 24 hours, taking the country's toll to 252. 131 of the positives are attributed to a call center in Portmore.
So the number of confirmed coronavirus disease 2019 COVID-19 cases has risen to 252, and that's based on 19 new cases that have been received in the last 24 hours. 9 of these, which we just received, we will provide additional information on in terms of male-female split, but 10 we received earlier today. That 10, 2 are males and 8 are females, with ages ranging from 20 years to 50 years. 7 are associated with the workplace cluster. 2 cases are contacts of confirmed cases, and 1 case, this is of the 10, is under investigation. There are now 131 confirmed COVID-19 cases related to that particular workplace cluster. Ages range from 18 to 52 years, including 104 females and 27 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew.
Antigua and Barbuda has reduced its curfew hours initially from 7 a.m. to noon to be between 6 p.m. and 5 a.m. until May 15th. During the 23 days, construction projects are permitted to recommence and restaurants may open for delivery, drive-through, and curbside deliveries only. All social distancing rules and the wearing of masks still hold. Meanwhile, no more than 2 people are authorized to travel together. Thus far, Antigua has 24 coronavirus cases, 3 deaths, and 10 recoveries. Grenada has recorded its 15th positive COVID-19 case.
The 15th laboratory case of COVID-19 on mainland Grenada has been confirmed. We therefore have 14 confirmed cases on island, of which 7 have been medically cleared. 6 are active, and of course, 1 is new. The individual is a 45-year-old male who, we announced to the nation, was admitted to the hospital on Sunday, April 19th, exhibiting symptoms consistent with COVID-19.
And Grenada is among the 20 countries around the world where Cuba has sent medical missions to help combat the pandemic. However, a U.S. blockade has been preventing many of these countries, especially in the Caribbean, from accessing medical supplies. We spoke earlier to Dr. Darj Maya Lipkis, member of the Cuban mission in Grenada, about this.
The restriction in all the world is for everybody, not only for Cuba or Grenada or China or UK. But however, we working with what we have here in Grenada. We have all the necessary supply to help and give medical treatment or for all the people that have COVID-19 or for prevent or for the prevention, because prevention is the most important in to prevent the spread of the COVID-19. Basically, here in Grenada, we have the necessary resource, not everything that we want to have, but we have the necessary, and the ministry and the government, he give to us all the support and everything that what we need to prevent the spread of the COVID-19. Currently here in Grenada, we don't have too much people sick. The spread is low, but we're working together with the ministry and the government and the population to prevent that become more seriously.
Moving on, Brazil's newly appointed health minister says his team is working to design an exit strategy for social distancing measures imposed by local governments. This comes after far-right President Jair Bolsonaro has continuously demanded that governors lift quarantine measures and called on his supporters to return to work, referring to the pandemic as, quote, a little flu.
If you analyze deaths per million people, the number in Brazil is 8.17. Germany has 15. Italy has 135. Spain 255. United Kingdom 90. USA 29. Our number is one of the best. Social distancing is an absolutely natural and logical measure at the start, but it cannot be without an exit strategy. That's what we are going to develop, and that's what we are going to do to support the states and municipalities.
A mass burial of COVID-19 victims took place on Wednesday in the capital of Brazil's Amazonas state, Manaus. Aerial images show the burial taking place at the Nossa Senhora Aparecida cemetery days after excavators dug the common grave. Relatives and friends of some of the deceased were also present to pay their last respects to their loved ones. According to local authorities, the number of burials since the pandemic started has gone from 30 to 100 per day. Manaus has so far confirmed almost 2,000 cases of the deceased and 172 deaths. Venezuelan President Nicolás Maduro has informed of 10 new cases of the novel coronavirus in the country. Let's have a look.
We had 10 new cases today, 2 of them in Táchira state that had no relation to recently arrived migrants, and 8 new cases in Nueva Esparta state, which are part of the outbreak detected at the baseball academy.
Maduro also announced that the total cases have raised to 298 and the recovery figure of 41% from the total cases.
With these numbers, Venezuela has reached 298 total cases, from 41% have recovered. 85 people remain hospitalized, 27 of them in private clinics, and we still stand at 10 deaths.
We'll take a short break now, don't go away. Welcome back to From the South, more news now. In Argentina, a second nursing home has been evacuated in Buenos Aires a day after another one was emptied due to residents and staff members testing positive for COVID-19. 9 cases of COVID-19 and 1 death among the residents was confirmed to relatives late on Tuesday. But relatives say it took nursing home authorities 5 days to inform them about the situation, and until Tuesday they didn't even know that residents had been isolated in their rooms. These are the first public cases of outbreaks of the new coronavirus in nursing homes in the country.
Last night, we were told that there was 1 deceased and 9 positive cases, 1 still being studied. Today, the authorities came after a week. They came today because the media was here, and they told us that none of the family members had a fever. We again asked that the test be done, but it seems to be a quite difficult task.
The number of COVID-19 cases in Ecuador has now passed 10,000, while the government is set to announce new economic measures to mitigate the impact of the pandemic. Our correspondent, Denise Herrera in Quito, has more.
In a virtual press conference, the Ecuadorian authorities informed that Ecuador has now 10,850 cases of COVID-19, and now Ecuador has 537 deaths. The main point in this health crisis now is the economic situation. Actually, two commissions of the National Assembly are discussing the two projects of economic reforms made by President Lenin Moreno. Most of the Assembly members of the National Assembly are rejecting these economic reforms. They said that these laws will affect all Ecuadorian citizens. In this context, the Health Minister of Ecuador, Juan Carlos Ceballos, just talked, and he said that the government is taking all the preventive measures in all the hospitals of Quito and the country to prevent the spread of the COVID-19. But as we know, the complaints made by the health sectors, the professionals of the health sectors, are still denouncing that they need the health equipment to face in the first line this pandemic in the country. As we know also, these two commissions who are discussing the economic reform will give their response in the coming days.
We thank our correspondent, Denise Herrera, for the report. With well over a third of the world's population under lockdown, education systems across the world have had to adapt to the extreme circumstances. In Ivory Coast, the government has implemented a project called My School at Home, by which students can receive classes from home. The project primarily uses the WhatsApp mobile application and Facebook to provide students with continued education. Authorities say that for the time being, the program is only available to people in the 5th, 9th, and 12th grade, but will soon be expanded.
True that we are in Abidjan, but access to TV is not easy for everyone. Personally, we don't have a TV at home, but with the online courses I can follow the lessons better, and even when you don't understand, you can ask questions to the teacher. You even talk like friends. It's very interesting. He answers you when you don't understand. He makes a voice message or even makes a video to send you, and then it is even more understandable. These are free courses organized by a group of private teachers in the community of Port Bouet and supported by the town councillor Mr. Bande Karamoko. These courses take place on WhatsApp platforms in groups of 50 students.
Ethiopia Airlines, the biggest in Africa, is facing a $0.5 billion loss in revenue amid the global crisis.
All kinds of problems that Africa has suffered, we have always stood with Africa. We have never abandoned Africa in bad times. Will we be able to sustain with only 15% of our revenue, because cargo constitutes only 15% of revenue? For a short period of time, yes. But for how long? Very difficult to predict.
In Kenya, the government has placed a lockdown on Madera County following an escalation of community spread of the coronavirus. Confirmed cases stand at 304 after 7 nationals tested positive in the last 24 hours. Interior Minister Fred Matiang'i said apart from a local shutdown, the government has locked the country's borders for an initial 21 days. The National Command Center on the Coronavirus Pandemic has also been ordered to review and strengthen the enforcement of public health measures in the counties of Mombasa, Kawali, and Kilifi. The United Nations has made an appeal for additional help in fighting global hunger. On Wednesday, the organization asked for an additional $350 million to combat what has been forewarned will be a hunger pandemic across dozens of countries as a consequence of course, the novel coronavirus. The World Food Program says that 250 million people could be affected, especially in sub-Saharan Africa, adding that it is already massively expanding its operations in order to face the incoming crisis and has worked to establish air bridges across all continents to transport humanitarian aid to those most in need. More stories coming up, don't go away. Welcome back to From the South, more news now. China has announced it will donate another $30 million to the World Health Organization to help in the fight against the coronavirus pandemic. This comes after the U.S. government last week froze its funds to the UN body, accusing the WHO of covering up the seriousness of the COVID-19 outbreak in China before it spread.
China has decided to donate another $30 million in cash to the WHO in addition to the previous donation of $20 million. To support the global fight against the COVID-19 and strengthen the health systems of developing countries. Supporting the WHO at this critical time in the global fight against the epidemic is defending the ideals and principles of multilateralism and upholding the status and authority of the United Nations. The virus is the common enemy of mankind, and the international community can only win the war if it works together. China's contribution to the WHO reflects the support and trust of the Chinese government and people for the WHO, as well as its contribution to the cause of world public health and the global fight against the epidemic.
Authorities in China have once again condemned what they call conspiracy theories and false accusations spread by the U.S. government, while U.S. President Donald Trump has shown no sign of slowing down in fanning these flames.
China is a victim of COVID-19, not an accomplice, says Zheng Xuan, a spokesperson of China's foreign ministry, following the latest accusations made by U.S. President Donald Trump.
The virus is a common enemy of all humanity, and it can appear anywhere in the world. China, like most other nations, was a victim of the novel coronavirus. We are not accomplices.
China, along with the international community, have rejected the conspiracy theories and wild accusations without any scientific proof lobbied by the White House.
U.S. Senator Tom Cotton alleged the virus originated in Wuhan's Virology Institute. After this, the Washington Post and other outlets wrote about how the virus came from a lab in Wuhan. They have no evidence, nor any logical reason to make that statement. They say this is based entirely on speculation. There has been no evidence showing that the virus was man-made.
Beijing has criticized the doublespeak of some Western politicians and media outlets, reminding them that in years past, none of them has asked the United States to apologize or take responsibility for other crises.
During this global pandemic, the international community has to come together. There is no time to throw accusations or demand that someone takes responsibility. I cannot recall something like the happening in 2009 when the H1N1 flu exploded in the United States and then spread to 214 countries, killing almost 200,000 people. Did anybody ask the US to pay for this damage? In the 80s, the AIDS epidemic was first discovered in the US and it has now spread all over the world. How many millions are infected? Did anyone ask the US to pay for that?
The COVID-19 pandemic has caused over 182,000 deaths across the globe, most of them in the United States, Italy, Spain, and France. Still, conservative media outlets and President Trump continue to speculate about the origin of the virus and attack China, a strategy that, according to experts, does nothing to save lives, but only works to divert attention from the failures of the U.S. government.
Beijing, China. In the United States, another 4.4 million people have filed for unemployment benefits, bringing the 5-week total to a staggering 26.5 million. The Labor Department report indicates roughly 16.2% of the U.S. labor force is suffering from layoffs, furloughs, or reduced hours. These numbers are likely to fuel the debate over when to lift restrictions that have helped halt the spread of the coronavirus, but hit the economy hard across all sectors. Early studies show lower income workers and minorities, specifically Black and Hispanic families, are expected to bear the brunt of the economic cost of the crisis. U.S. President Donald Trump has signed an order partially suspending immigration to the United States, arguing that drastic measures would protect jobs during the coronavirus crisis. The suspension hits people applying for permanent residency or green cards. Seasonal workers, such as immigrants vital to U.S. farm labor, are still allowed to enter the country.
To protect our great American workers, I've just signed an executive order temporarily suspending immigration into the United States. This will ensure that unemployed Americans of all backgrounds will be first in line for jobs as our economy reopens. Crucially, it will also preserve our healthcare resources for American patients. We have to take care of our patients. We have to take care of our great American workers. And that's what we're doing. So I've just signed it just before coming into the room.
The coronavirus death toll in Spain has now passed 22,000, with 440 people dying in the last 24 hours. On Wednesday, Spanish Prime Minister Pedro Sánchez said he hoped Spain could begin to ease its restrictions during the second half of May, but warned that de-escalation will be slow.
Unfortunately, we still have 440 new deaths, and although these are still many more than we would like, we all know what this means. It is true that throughout this week we are remaining in the low 400s, from 400 to 440 as of today, whereas last week we were in the range of the 500s.
The UK's chief medical advisor has said that social distancing measures in the country may have to stay in place for the rest of the year, adding that the possibility of a vaccine or treatment against COVID-19 being discovered this year is incredibly small. Measures in the country may have to stay in place for the rest of the year, adding that the possibility of a vaccine or treatment against COVID-19 being discovered this year is incredibly small.
In the long run, the exit from this is going to be one of two things, ideally, one of which is a highly effective vaccine, and there are a variety of ways vaccine, even if they catch it, or which can prevent this disease in vulnerable people. Until we have those, and the probability of having those any time in the next calendar year are incredibly small, and I think we should be realistic about that, we're going to have to rely on other social measures, which of course are very socially disruptive, as everyone is finding at the moment. But until that point, that is what we will have to do, and it'll have to be the best combination that maximises the outlooks. But it's going to take a long time, and I think we need to be aware of that.
The French government has said that cafes and hotels may not be able to reopen on June 15th, despite lockdown measures to be eased starting from early May.
Our ambition is to work together. We also need time to develop the various scenarios for business to resume, so I obviously cannot confirm the date of June 15. What I can tell you, however, is that we are aware of the particular difficulties facing this sector, which will not be able to resume its activity, as the President of the Republic has indicated, at the same time as the other economic sectors, and which, as such, will need special assistance. And that is why we are currently working in consultation with the sector to have a specific plan of support and assistance for hoteliers, cafe owners, and restaurant owners.
All over the world, experts are trying to discover a cure for the novel coronavirus, and in many countries, this has meant using the plasma from recovered patients to treat some of those who are in critical condition. Such is the case in the Philippines, where doctors say they are trying to harness the antibodies developed by recovered patients as an experimental drug.
Someone who has recovered from COVID-19 will have antibodies against the virus that causes COVID-19. So we harness that. We take advantage of that. So we ask our survivors, we call them survivors, COVID-19 survivors who have fully recovered from COVID-19, to donate their blood, specifically their plasma where the antibodies are.
Right there and then, when I was asked if I was willing to donate my plasma, I never had second thoughts to donate. So I immediately said yes. It's just a small contribution, doing my part to help other patients in my own way.
In Germany, a trial of two alleged former Syrian intelligence officers who are accused of crimes against humanity has opened. Anwar Raslan and Ayad al-Gharib stand trial for murder and torture in the first court case worldwide over state-sponsored torture by Bashar al-Assad's regime. Raslan is accused of overseeing the murder of 58 people and the torture of 4,000 others at a detention center in Damascus, while al-Gharib is accused of having helped to arrest protesters and deliver them to prison. The two men fled Syria and applied for asylum in Germany, where they were arrested in February of 2019.
The defendants are suspected of being responsible as managers of Unit 250, a Syrian unit, for the deaths of 58 people and the torture of at least 4,000 detainees. They are accused of crimes against humanity and murder, among other things. This process is not only important to us personally, it is also important for the victims who are alive, who are still in prison, and also for the victims who are no longer alive. It is the restoration of dignity for all of us.
And with that story, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And for our viewers in Africa, remember you can find us on StarSat channel 461 in South Africa and channel 539 in Nigeria. And be sure to follow us on social media as well. For Telesur English, I am Estefania Bravo. Until next time.